today we're going to be performing a rhinoplasty or nose surgery. So the patient comes in and is unhappy with the hump of the nose here. She's also unhappy about the rotation of the nose as the tip is drooping down, as well as it's not being projected enough. Some of these things you can see a little bit better here on the picture. Point out the hump, the tip that's drooping down and not projected enough, as well as the tip and the middle third of the nose overall being wide. Also, it's hard to appreciate from the picture, but the nose is somewhat crooked, and so I may have to add a little piece of cartilage here to the left side to straighten that out. So all of that will be done today. The only incision that you'll be able to see on her will be a small incision at the base of the nose. Everything else will be done on the inside. And so once we get going a little bit further, we'll show you some more. The nose appears to be a little bit white and swollen right now. That's because I've already injected it with local anesthesia. That causes the swelling. The white part is the epinephrine that causes some blanching. That helps us out a lot. So if there's, it really cuts down on the blood loss and the bleeding during the surgery itself. All right, so we're back. I'd already removed the piece of cartilage or from the septum that we'll use here as part of the rhinoplasty. The next thing I'm going to do is make this incision right here at the columella. That's what we call this inverted V incision, and then there'll be incisions made inside the nose here. And then this skin will be lifted back, and it will give me access to pretty much everything I need to do as part of the rhinoplasty. So once we get more into it, I'll show you that. We can show some of the different steps. So I've made that incision, and I've elevated this whole area, this whole skin, so I can put a retractor and kind of peel that skin all the way back to about right here. So the next step is I have what we call a rasp. It's essentially just a file. And I'm going to file down the bony portion of the dorsum right here. And that's for the bony portion that comes from about here to here. This other portion is cartilage, so I'll need to take that down sharply with a knife. So the next steps will be doing that, taking down the dorsum, and then we'll switch over to addressing the tip and also the crooked portion of the nose. Okay, so we went ahead and removed the dorsal hump. So part of that was rasped down this portion, and then with a knife I sharply took down this portion. So you can see now the dorsum is nice and straight. Some people like to have a little bit of curvature. I tend to like to make it mostly straight. But however, you can see the tip of the nose is still somewhat wide and it's drooping. So the next thing we're going to do is address that. Also, one other thing that I will probably do is what people call breaking the nose. It's really not breaking the nose, but it's a controlled cut that's put right here in the bones on either side, and it allows to somewhat of the narrowing of the middle to upper third of the nose, and so we'll do that as well. All right, so we're back. I went ahead and trimmed some of the lower lateral cartilage, or an area right here. So that's going to make the tip of the nose more narrow. The next step that I'm going to do is I'm going to do what they call the breaking of the nose, but it's really a controlled cut that will be with this instrument here, and it will come all the way up here. And so it will allow the middle and upper third of the nose to become less wide, so we'll bring those in so it'll be narrower. The tip is all cartilage, so we don't need to have any type of bony work on that. That's all cartilage work, which will be some incision, which we already did, and some sutures. I'm not going to show this part of the video because everyone thinks it looks a little violent, but that's what happens. It is a controlled cut, and it's not just a hammer on the nose itself. So it's a controlled cut put on the nose itself so that the bones can be moved inward. We'll be back in a little bit. So this is the cartilage that I removed from the septum, and I'll use for the nose. Will be put in the middle third of the nose. So I'm gonna make this into a little bit more of a triangular piece. So I'll cut that with a knife, and then I'll put this piece. We'll put that in the middle third of the nose. We've already done the osteotomies, and we've made some cartilage removal on the tip of the nose. So we're getting close to the end. So after I put that in, we'll come back and show. Okay, so we've accomplished just about everything we wanted to do. Just to kind of rehash what I've done is I removed both the bony and the cartilaginous dorsum to take off the hump of the nose. I've narrowed the tip of the nose. I've elevated the tip of the nose and increased the projection on the tip of the nose. The patient also had one other thing. The nose was slightly crooked to the right side, and I put and it was left a depression here. I put a spreader graft or a piece of cartilage in between this area here to help out so that the nose was straight again. So those are the things that we accomplished today and we're looking to accomplish. I've already put the sutures back here on this columella, or this bottom portion of the nose, and for the most part we'll be ready to put tape and a splint, and then we're done. And we'll show you with the tape and the splint, but you may want to look just over here to the preoperative photo just briefly, and you can see, especially here on this lateral, you can see the hump in the nose, the drooping tip, and the under rotated tip. And from this view you can see kind of the width of the tip, and so all those things have been corrected. So we've accomplished our goals so far. Put the tape and the splint on, and the patient just needs to heal. Ready? Okay, so we're all done. We put the tape on and we put the splint. It's just a moldable splint to keep things in place. Sutures are there. So this is what the patient will wear for about 6 days. She'll come into the office, she'll take a shower that morning. This will pop off, we'll take the sutures off. Overall, most people do not feel it's a very painful procedure. They usually take pain medications for a day or two and don't feel like they need much more. The thing they complain about most is having congestion, and that usually clears in about a week. Again, I'm Dr. Mark Jabor, Cosmetic Surgery and Laser Center of El Paso. Thank you for watching.